I am very happy to share my experience of the joint pains which I come across in my practice. It is mainly in the field of orthopedics, and this I call lifestyle disorders because of faulty lifestyle. Many of my patients and also medical colleagues suffer with these problems, and I hope that this will be useful not only to my junior orthopedic colleagues and postgraduate trainees, but also to the patients who may have visited this site. I am grateful to Pharmed Limited for giving me this opportunity to reach out to the world, including my colleagues and patients. My today's address is lifestyle disorders affecting the patients and who visit us almost in a very large numbers. In fact, my daily outpatient, 60% patients come complaining of joint pains, body pains, and also in various parts of the body, for example, neck pain, lower back pain, knee pains, ankle and foot pain, and you name the area which they don't have pain. You can't name any area where they don't have pain. The problem is not only affecting the advancing age, but also the young professional colleagues in other specializations where they are using monitors and odd hours of working, faulty diet habits, finding no time for exercise, no time to proper sleep. They have almost forgotten our old culture of doing yogasanas, pranayam, meditation, which formed part of our daily routine in this country. Because of adopting the Western lifestyle, sitting only on chairs, sleeping only on beds, traveling only with fast vehicles, not walking in the sun, and those who do not work also don't find time to do exercise. The reason they give is that they don't find time. And a person who is not working, why doesn't he find time? Because his major distraction is digital distraction, and he doesn't find time for proper healthy life. They take high calorie food which the body cannot utilize. Reason for not able to work is their extreme activity, whether they work or not. Even for the short distances, they do not walk. They want to use motorized vehicles. The major cause of obesity, which is also a lifestyle problem, is high calorie food, and using the Western lifestyle for living. They find the students don't find time for sport, and the electromagnetic waves and their habits spoil their health. This includes alcohol, smoking, not stretching the joints. Alcohol can affect the hip joints, causing avascular necrosis and pains in the hip joints. Smoking can cause degenerative disc disease of the spine, and not stretching all the joints fully will lead to various causes of osteoarthritis, all over the degenerative arthritis, all over the body. Lack of breathing exercise will reduce the lung capacity of breathing. Along on the top of this, there is ignorance both on the part of patients as well as their medical advisors, family physicians, the physician they visit to, being only trained in a limited field, they are unable to fathom that cervical pain can stretch from the top of the head to the lower back, chest, the whole body almost till the lower back, and both upper limbs. And because of the variety of symptoms, the cervical spondylosis or cervical disc in the younger causes, they will complain of pain in the top of the head, giddiness, they will feel pain on the side of the face, they will get tingling numbness in the hands, they will get chest pain, they will get also giddiness. This will all lead to various specialists getting in and giving them different advices. Even a pulling sensation in the eye can be an ophthalmic problem because of the pain in the back of the head. And they go to ophthalmologists. Because of the ringing in the ears, they go to the ENT people. And because of the head pain, they go to the neurologists or neurosurgeons. And when they come to me, they have big file and a background of suffering for months and years. And they all can be categorized as a patient who are suffering with cervical pain because of disc diseases in the young and the degenerative spondylosis in the elderly. This applies also to the lower back pain. The faulty lifestyle, sitting crouched on the chairs, bending down on the monitors leads to low back pain, and using elevators will cause osteoarthritis in the knees. So what is the solution? The solution is that adopt Indian lifestyle, walk in the sun a little bit, maybe for 15-20 minutes, even that will do. Don't use elevators and motorized vehicles as far as possible for short distance walking. Then use healthy diet. Then there are joint supplements, chondroprotective DMRs for the joints, which you can use. They are not medicines, but they are DMRs. Disease modifying drugs. We have got calcium, vitamin D, which improves the bone strength, particularly in the people who have got a lifestyle which demands being inside a closed room. Many people do not even realize that this will all lead to joint pains, including my colleagues. So in the end, I will say that keeps your joints moving, keep a healthy lifestyle, and take advice of proper medical specialists. The slogan which I very often use in my outpatient addressing to the patient, that life is all about movements. If you don't move, you will suffer, and lack of movement will give you pains in the joints. Therefore, I call the rest as rust of the human body. Please remember this. Thank you.